Hello. So, shall we just start off while they join in? So, both of us are speech language pathologists here, myself, Karen and Corolla, and
Myself, Kripa Sophie Vinod.
so we work here at NeuroGen Brain and Spine Institute as speech language pathologist. And today we are here to talk more about what exactly we do here in speech and language therapy, what disorders we focus on, and what kind of management that we do here. So let us explore more into the world of speech therapy.
So we speech therapists mainly focusing on the evaluation and diagnosis, treatment, and prevention of the disorders. And also, in this, we are mainly focusing cognitive communication disorders, like cognitive communication disorders, which deficit may occur after a stroke, tumor, brain injury, or a progressive degenerative brain disorder. Uh, these deficits may result both cognitive and language problems. And also, we will work with the swallowing disorders, the person with having difficulty in while swallowing. So we will also work with them. And also, we are working on the communication disorder also. Communication disorder is an ability, it is the ability to receive, send, process, and comprehend concept of the verbal and non-verbal and a graphic symbol of system.
So communication disorders are basically classified into two different types, wherein we deal with both speech disorders as well as language disorders. And speech would include voice, fluency, as well as articulation disorders. And language consists of both child language disorders as well as adult language disorder. So we're going to talk not in detail, but we'll just brief you about what exactly is each one of them and what kind of management we provide for each of them. So, voice disorders are disorders wherein the voice quality, the pitch, as well as the loudness of the particular individual or the client would differ from the normal range. So, irrespective of the age, gender, cultural background, or all of these, if there is any change in the quality, pitch, or the loudness, we would classify them as voice disorders. So, what can be done for, or what could be done for voice disorders? The main management that even before giving them directly with voice therapy or providing them with the voice techniques as such, we would suggest them to go forward for the vocal hygiene tips or the strategies that can be done so that that could subside the issue that they are having. If it does not resolve with the vocal hygiene tips as such, we would suggest them to carry out any kinds of like there are various techniques that can be done to improve the voice quality. So depending upon the type of voice disorder or the category that they fall into, we'll be giving them with the appropriate technique as such. So voice disorders, we also try to improve the self-awareness of the voice quality, as well as we'll try to facilitate the individual's activities and life participation. And also we modify the contextual and environmental factors. So these are the things that we try to do or inculcate while dealing with a person or individual with voice disorder. Moving on to the second category in speech disorder, that is the fluency disorder. Here, fluency disorder can be mainly classified into stuttering and cluttering. So these individuals will be having stuttering disorder individuals, they'll be having issues with the normal fluency as well as the flow of speech. And stuttering is colloquially known as stammering, whereas in DSM, it is referred to as childhood onset fluency disorder. And these people might know what they want to say, but they may have difficulty saying it. So, how can we identify an individual with stuttering? So, these individuals will exhibit both primary or major, there are few core characteristics or features of stuttering, as well as few secondary behaviors. So, few of the core characteristics include the repetition, prolongation, as well as blocks. So we can just demonstrate maybe one or two of them for you so that you can have a clearer idea about stuttering. So repetition also like can be classified into, it could be word repetition, syllable repetition, or sound repetition. So let's just give you an example, or let us just demonstrate how stuttering or how repetition would take place in stuttering. So I am going to be the clinician here and she is going to be the client. So if I'm going to ask her, what is your name?
My name is Kripa.
Okay. So here she was trying to repeat the initial syllable of of her name. So Kripa is her name and she was repeating k. So that would be the syllable repetition. Now, if it's going to be a word repetition, what is your name?
My name is Kripa.
So she would repeat the entire word as such. So that's going to be word repetition. Moving on to prolongation, wherein they are going to prolong, maybe it could be the initial syllable, it could be the medial or the final one, wherein they would just elongate or prolong that particular sound of the word. So I'm going to ask her, what is your name, please?
My name is Kripa.
So as you can see, she was taking more time to produce the sound kr when compared to the other syllables. So that is wherein they exhibit prolongation and such. So what could be the management for all of these? Even before moving on to the management, we would like to introduce you to the next category of fluency disorder that would include cluttering. So cluttering is wherein the individual is going to have a very rapid rate of speech, erratic rhythm, as well as poor grammar. So this rapid rate of speech can be classified or termed as tachyphenia, and individuals with cluttering are going to have very poor awareness about themselves, that they clutter or their rate of speech is really fast, as well as self-monitoring skills. So we can just demonstrate how these individuals talk or converse with other people. So there are no language issue as such, wherein they are not having any difficulty. They would not exhibit any of the characteristics of stuttering, but rather they would have a very rapid rate of speech. So if I'm going to ask her, can you just talk about yourself?
My name is Professor Vinod. I'm from the I'm also from the NeuroGen Hospital of the.
So as you can see, when she was trying to talk about herself, whatever she was saying was not clear enough or it was not comprehensible for us, as well as the rate of speech was very fast. So this is wherein we classify the individuals as having cluttering, because the fluency of the speech is getting affected due to the rapid rate of speech. Now, moving on to the management of fluency disorders, these are just few of them that we've included here. So, prolongation, airflow techniques, and bounce are few of the techniques that we provide for individuals with fluency disorders. And analogies can be given for children. So, analogies would include it could either be a pictorial representation or we can explain it to them, wherein it would be easier for children to understand what exactly we mean by the technique and how it's going to help them out. So we can just demonstrate one of the most commonly used technique in fluency disorder. That's going to be airflow technique, wherein airflow technique is a technique where we try to ask the individual, wherever they're going to stutter, we'll ask them to stop, take a deep breath, and try to prolong the initial syllable of the word. So if I'm going to ask, so she's going to be the client, I'm going to be the clinician, and I'm going to ask her, what is your name? And as we all know, she stutters at her name. It's not what or my name is. She stutters at the word Kripa or her name itself. So let's see how she's going to tackle it. What is your name?
My name is.
She has stopped, she took a deep breath, and then she's going to prolong.
Kripa.
So that is one of the technique that we can use to avoid or tackle stuttering.
So next we are moving on to the articulation and phonological disorders. We are termed as a speech sound disorders. In articulation disorders, which includes most of the errors, the production of the individual speech sounds, which include substitution, omission, distortion, and addition. When it comes to the phonological disorder, can produce a sound correctly, but may use them in wrong place, like frowning, backing, stopping, denasalization, final consonant deletion, and cluster reduction. The major treatments are correct the production and pronunciation of the target sounds, and also will eliciting the target sounds and stabilizing the production of voluntary level, and also will give the generalization, like carry over the speech at increasing level, and also will do the maintenance like self-monitoring and corrections.
So these were all classifications of the speech disorder as such. As we have told, communication disorder would mainly include speech as well as language disorders. Moving on to the language disorder, as we've discussed earlier, language disorders may include both adult as well as child language disorders. But here we mainly attend to children with autism spectrum disorder as well as other developmental disorders like cerebral palsy. So let's discuss more into both of these disorders. So the first one would be autism spectrum disorder. So as you all know, autism or autism spectrum disorder is a very vast term, but today we are just going to focus upon what are going to be the communication deficits exhibited by individuals with autism spectrum disorders, and what are few of the techniques that we use here to treat them or to manage the deficits that they're facing. So the major communication deficits or challenges that these people face are difficulty or in understanding and using gestures and words, following directions, learning to read and write, as well as having conversations. These people may also lose early word, be hard to understand. They could repeat or words or phrases. So as we all know, or we're all familiar with the term echolalia, wherein they just repeat the word or phrase as such. They may have a robotic or sing-song speaking voice. They talk very little or not at all, and they would also have challenging behaviors. Now, here are a few signs that can be used for the early diagnosis and intervention of an individual with autism spectrum disorder. So, 5 of them could include they would either have a very slow response or no response at all to their name. They would be having delayed or absence of gestures, like they would not point to the object or whatever they would want to communicate or indicate. They would have a slower rate of language development. They would be usually, if they are verbal ones, they would be using single words rather than using a phrase or a sentence, as well as signs of echolalia could also indicate or help us diagnose with autism spectrum disorder. So depending upon the person's need, we speech language pathologists would also help them to work on the following skills, like getting along with others in different settings, using a variety of communication supports, taking turns in conversation, moving from one task or setting to another, accepting change and expanding interest, like trying new foods and activities, as well as for reading and writing skills. Now, let's move on to few of the management techniques or strategies that we use here to manage for children with autism spectrum disorder.
That is one of the thing is child-directed play. In this, we will mainly the child selects the activity and material or topic. The adult insert the intervention with the context. And also in this, child-directed play may be beneficial because the children with autism, they have difficulty in disengaging and shifting attention process that require more by adult-directed play compared to self-directed play. And the next is reinforcement. Reinforcement can be characterized into two main types. One is positive reinforcement, other one is a negative reinforcement. The positive reinforcement involves providing rewards to encourage desired behavior, while the negative reinforcement involves removing aversive stimuli to achieve the same goal. The next thing is imitation. There are three steps to implement the strategy of imitation. Like when it comes to the imitation, there are two types of imitation. That is, one is verbal imitation and other one is non-verbal imitation. Verbal imitation, which include, we'll ask the child to make sounds like animals, like cat says meow or the cow says moo moo. These are the verbal imitation. When come to the non-verbal imitation, we'll ask the client to touch your nose, touch your ears, touch your eyes. These all come under the nonverbal imitation. And the next one is prompting. Prompting can be accomplished in many ways, including more direct prompts such as physical touch, as well as more stable prompts such as gesture, single words to support attention. There are three types: physical, uh, gestural, and visual. And next is role of caregivers. Families and caregivers have to play their child while teaching skills like talking about what you are saying or doing, or talking about what a child is saying or doing, or adding extra words for what a child has said, and providing enough helps to complete a task while still letting the child do it themselves, and also providing sensory supports during the play.
Hope this was clear enough for you to have a very brief idea about what autism spectrum disorder is and how we try to manage these children over here. So these are just very few techniques that we use here. There are various ample amounts of techniques and strategies that can be used for the treatment of autism spectrum disorder. So as I've told earlier, we also deal with children with cerebral palsy. And moving on to cerebral palsy as such, cerebral palsy, individuals with cerebral palsy would often have difficulties in speech as well as swallowing, ranging from mild to severe. So the main treatment or the management that can be done for cerebral palsy is oromotor rehabilitation. So here, uh, what exactly is done in oromotor rehabilitation? We give them with exercises to strengthen the muscles that are used for both speech and swallowing, as they will be having deficits in both speech and swallowing. And this would in turn enhance the coordination and the range of motion in the oral movements. So moving on in detail into the oromotor exercises as such, we would just brush up as to who would need oromotor exercises. Individuals having speech sound errors or delayed verbal language skills, children with open mouth posture, children with their tongue hanging out, the ones with drooling or excessive saliva secretion, children wherein they would have the food fall out of their mouth while feeding, difficulty in chewing and biting, difficulty with the tongue movements, if they have choking or coughing while having food, gagging while feeding, if they are unable to any of the difficulties with the vegetative skills like sucking, licking, chewing, blowing, or if they would have any kind of food preferences, we would suggest them to go forward with or to carry out oromotor exercises. So as I've told, blowing is one thing that we focus on in oromotor exercise or the vegetative skill as such. So here we would ask them, we would enhance or strengthen the structures or the articulators to improve blowing, because blowing as such is going to improve, which will in turn, if we are going to carry out activities to improve blowing, this will in turn improve the speech as well as aid in the swallowing. So we could ask them to blow bubbles or a whistle to train the mouth muscles to produce certain sounds, as well as that this would also help them to strengthen the abdominals for breath control. So we would also focus on each of the articulator as such to improve the strength and coordination of each of the articulators, so that that would aid in better speech as well as swallowing. So let us go forward with what kind of exercises we provide for each of the articulators, starting with jaw exercises. So we would be giving them with exercises that are going to improve the muscles of the jaw as well as to strengthen the jaw. So for this, one thing that can be done is we could either ask them to open and close the jaw for the movement of jaw, like this can be done, as well as we can ask them to move the jaw from right to left. This can be done. Along with it, we would also suggest them to go for chewy chew. So chewy chew is not just going to help them with the jaw movement, but also that would help them with biting and chewing. Chewy tube itself are of four major types, depending upon the color that we choose. So we've got yellow, red, green, and blue chewy tubes. So each one is would serve a different purpose, wherein the yellow one is given for infants, very small children, as it has a very small tip. And the blue one is the one at the higher range, wherein it has got a very thick end, and that would be given for adults or individuals who are having better movement. So we've got a chewy tube here. We would just demonstrate how to use the chewy tube. So we've got the red one here, and red one is can be used for anybody, irrespective of the age. So this is the chewy tube, if you can see here. And we would always recommend them to hold it in this manner, wherein both of your forefinger and your middle finger is going to rest over here, and your thumb would go in the middle. So that you can hold the chewy tube in this way, and then you're going to put it inside the mouth. So we are going to do it to improve. If it is for biting as such, we are going to put in this portion right into the incisors, and then we would ask them to bite as such. If we feel like they're not able to bite even after inserting the chewy tube, we can just support them, and then we can just help them to bite. So in the same manner, if we are going to insert it right into the premolars or molars, this is going to help them with chewing as such. So again, if we feel like they're not able to chew by themselves, we can just aid them using our hand, so that it's going to give them a movement, and then they would start chewing as such. So this is going to improve both the biting, chewing, as well as the jaw movements. Here we've got a video clip of
Sure.
us using a chewy tube over here in our center.
Does not chew, you have to push from down. 1, 2, 3, 4, 5.
So as you can see, since the child is not able to chew by herself, we are just helping her to move the jaw right up and down so that she can chew. Here, if you would have noticed, they are not holding it in the right manner, like the chewy tube. Doesn't matter that you will have to place it in that way itself, but this would be the ideal position for us to hold the chewy tube and then insert. If we feel like now, since we've got the blue chewy tube here, it would be hard for her to chew on. So we would suggest you to use the other side. Moving on to lip exercises.
So lip exercise which includes squeezing their lips. Like if I'll ask them to sit straight and ask them to look at my face and just do like this. This is lip strengthening exercises. And also we ask them to do this. So these all these all exercise we are doing when it comes to the lip movement, any lip weakness are there. So we'll do this. And also if anything like straw or something is there, ask them to hold with the lips. This is also will helps to improve the lip strength. And also next is tongue exercise. Like when improving this tongue strengthening exercise, to will ask them to put out the tongue like this and ask them to do this. If they are not able to do that, I'll ask them to use the tongue depressor, and
So we'll just ask them to stick out the tongue, and then we'll ask them to push hard against the tongue depressor, so that would improve the strength of the tongue. Also, we can give them with exercises to improve the movement as such, movement of tongue for the movement and coordination, wherein we would request them to stick out their tongue, move the tongue from one place to another. It could be in the lateral direction from right to left in this manner. It could be to elevate the tongue up, down, as well as to lick your lip, like from one end to the other. All of these exercises can be given for them to improve the tongue movement, as well as that, along with the exercise that we've told over here, you can also ask them to put the tongue over here right at the cheek, and then we can also push hard against the tongue. This can also be done to improve the strength of the tongue. So these are just few things that you can do to improve the tongue movements. And this is whatever we have explained right now. So all of this, whatever we have told, like as you can see in the picture, the first one is for him to elevate the tongue, for him to move the tongue from one place right to left. And then we are doing the tongue manually, like we are moving the lips as well as we are asking them to move the tongue accordingly with our hand. As you can see, they're not using a tongue depressor over there. Instead, they have an ice cream stick to improve the strength. So that is for him to, we are trying to push in the first picture right below. We are trying to push down the tongue and they are trying to elevate the tongue. In the second picture right below, what you can see is they are trying to move the tongue to the right side and we are trying to apply pressure or resistance to the tongue. And the third picture is wherein we are trying to push the tongue back and they are trying to push the tongue depressor forward. And the last one is wherein we had demonstrated with the straw, we would ask them to hold any object. It could be an ice cream stick or a tongue depressor, anything of that sort, with the lips to improve the lip strength. So we've got a small video of one of the exercise that we do here to improve the lip strength.
2, 3, 4,
This is another exercise that you can do to improve the lip strength as well as the range of movement of the
9,
lip.
10. Good job. 1, 2,
So this is wherein we would use our thumb to do the exercise.
5,
We would, I hope I'm audible. We would place the thumb right at the center portion near the philtrum and then move from the middle to the center. So this is done with a little bit of pressure. So this is done to both the upper lip as well as the lower lip. Hope it's clear. Moving on to the next one.
Next one is ZY brush. It is a vibratory oral motor tool. So this is mainly we are giving the patient with muscle weakness or any they don't have movement, any structurally any problem. So we'll give ZY, and also the patient with sensory issues, we'll give ZY brush. I'll just demonstrate how it will be using. Okay, this is the brush. This is the brush. This is the tip of the brush. This we can remove. Okay, this part we will use inside the mouth and this part we will use outside the part. So we will attach the tip and this we have vibration. This brush we have vibration.
We just have to turn the knob to start the brush as such. So now the brush is actually vibrating. When you just turn the knob to the right side, the brush will start vibrating.
So then next what you have to do, as I already told you, like this one is outer part. This one we will use for outer part of the cheeks. Like we'll start clockwise and also anti-clockwise. The same way we'll do the both sides and also we can do upper lip portion and also lower lip portion. And also the next, I already told you this part we will use the inside of the mouth. I'll ask the client to open your mouth and I'll put inside and do the same thing, clockwise and anti-clockwise. We can use on tongue also. I'll ask the client to put outside the tongue and I'll place it like this and also I'll do the same thing. And also I can do the rotation movement at the tongue also.
So these are few of the oromotor exercises that you can suggest for individuals who are having deficits in speech as well as swallowing disorders. Now, moving on to the articulation therapy as such. In order to carry out the articulation therapy, we would focus mainly upon the sounds and the production of each speech sound. So here we would teach them how exactly the place as well as the manner of articulation of each sound. So we're going to take up a particular sound and then we're going to show them how it has to be done and where it has to be done. For example, if we are going to take the sounds like p and b, those are called as the bilabials, as you can see here. So each sound is going to have a different place of articulation as well as the manner of articulation. So, speech sounds like p, b, m are bilabials, wherein we would require both the lips. So we would ask the client to bring the lips together and then produce p. Similarly, p. So how do we differentiate between all of this? Even though the place of articulation is similar, so that is where the manner of articulation comes in place. So if the place of articulation is similar, so initially we would teach them the place of articulation, as that would be something that would be easier for them to understand because they are getting a visual cue as to how to produce the sound. But with that, they might get confused or they might not be able to differentiate between the sound classes. For example, as I've told you, pa, ba, ma, all of them have the same place of articulation, that is the lips. But how to produce it is where the real aspect lies, how to differentiate the different sounds. For example, pa is a voiced sound and p is an unvoiced sound and b is a voiced sound. So that is how you can differentiate between p and b, whereas m is a nasal sound. It is a nasal consonant. So in this way, each speech sound, as you can see here in the picture, each one has a different place of articulation and manner of articulation that is going to differentiate between the speech sounds at the same sound class. So we would teach the client how we would start articulation therapy is we'll have to initially teach them with the sound as such, the specific sound in isolation. So we're just going to teach them with the sound. And then once we feel like he has mastered how to produce the sound correctly, then we would ask them to do the same thing with a word. So we're going to give them with the list of words wherein this particular sound is going to come at the initial position, sound words with the sound in the medial position, as well as words with the sound in the initial final position. So then they would be given with various word list wherein all of these, whatever is going to be your specific or target sound, that would come in various positions of the word, and then they would have to produce the sound in the word. Once you feel like they can do it even at the word level, then you move on to the next level, that's going to be the phrase level, and then you're going to give them with sentences. Then later on, once you feel like even in a sentence they can do it properly, we can ask them to read a sentence as well as the last step. So they've already mastered the sound, the word, the sentence, as well as reading. Then the last step would be to have a proper conversation as such. So this is how we'll have to carry forward articulation therapy. Now, moving on to the benefits of oromotor massage as such.
The benefits of oromotor massages, the positive impacts are oromotor massage can improve the muscle tone in the mouth, leading to better speech production. So it will help the better speech production, and the massages can help increase the coordination of oral muscles and leading to improve the swallowing abilities. And regular oral motor massages can also assist in reducing oral sensory deficiency. And consideration, some individuals may find oromotor massages uncomfortable or invasive, and it is important to have proper training to perform oromotor massages safely and effectively. And results from oromotor massages may vary depending on individuals' needs and conditions. Next, we are moving on to the oral placement therapy.
So oral placement therapy is a part of speech therapy, which would include, so as the term suggests, oral placement, we are going to show them or we are going to aid them with the cue or a prompt. So this could include a combination of the auditory, visual, as well as the tactile stimulation to improve the overall intelligibility of speech. So for this, it could, if it's going to be the tactile stimulation, we would have to use our hands or anything as such to aid them or help them how to produce the speech sound. For example, as I've told you earlier, for the class of some bilabials, p, b, m. So if they're having difficulty to produce the bilabials, we're going to use our hands and then place it on the lips, aid them. So this is how you can help them out. So this is going to give them a tactile cue. Along with it, you can show them how it is being produced, like ha, ha. So this is going to give them a visual, and if I'm going to say it loud, they're going to get an auditory cue. So this is how we are using all of these cues or stimulations to improve the clarity of speech. And this is called as the oral placement therapy.
And the straws are the pillar of oral placement therapy and promotes jaw, lip, tongue coordinations. And next, we are moving on to swallowing exercise. So, swallowing, we know, like when the patient comes to the swallowing difficulty, they have difficulty in the oral preparatory phase, and also they have difficulty in the pharyngeal phase. So, we are mainly focusing on the oral preparatory phase. Then feeding and following therapy. Techniques to improve safe and effective swallowing function and addresses difficulty with chewing, swallowing, and oral movement. So we are mainly focused when it comes to the patient with swallowing difficulty. We are mainly focusing on the chewing skills and also swallowing and also the oral movements. If the structure is not working as a proper, so we are first initially we work on the structure, like we'll work on the strength. If the strength is not there, the lip is not functioning, the tongue movement is not there, then we'll work on it, and also we'll work on the gag reflex. If gag is not there, we'll give the thermal stimulation for that particular patient, and we'll work on this structure first, then we will give the next step. The next is like feeding disorder and swallowing problem, that in many instances place that in the risk of aspiration with oral feeding with potential pulmonary consequence.
So in order to avoid all of this, it is not just the techniques or strategies that we can use, but also we can modify the environmental factors. Like we could adjust the posture, the feeding, the utensils that you're giving them. All of these environmental modifications could also aid or help in feeding as well as swallowing. So let's look into few of the utensils or the things that we can use for children with cerebral palsy.
This is a spoon. This is the main food utensil. It is a metal and or a plastic. Have some consideration for its use. Like, for example, this food, this edge is very soft, and this we can place it like this. And with the finger, we have to do this. Don't pour it inside the mouth. We ask them to close their lips and do this. So this spoon will help with the patient with the cerebral palsy.
The next one that you can modify would be the plates that we give them with. So plates wherein they have a very raised edge rather than having a plate or a flat dish, so that food might spill over. If they are trying to have food by themselves, due to the physical issues that they are having, there are chances or possibilities that the food can just fall off or spill over on the table. So better to have plates that has got a raised edge that would facilitate the withdrawal of food from the dish, as well as help them to overcome the spillage of food on the table. Moving on to the next one, that's going to be a nosy cup, which is mainly used for drinking as such. It could be water, juice, or any liquids as such. So the main purpose of having a nosy cup rather than the normal cup is they've got a groove over here that would be placed right into, or that would go at our nose. So if it is going to be a normal cup in this way, it's going to be hard for them to take it in because the nose is obstructing the passage. So if we've got a groove right here, they can place the lips, as you can see in the image, the cup position, the portion without the groove, they're going to place the lips over here, and then they're going to take in water so that the nose is going to fit right into the groove, and this would help them from spillage of water. Also, we would recommend them to take in very small sips of water instead of gulping water. So that could also avoid aspiration as such right into the lungs.
So multidisciplinary approach, the collaboration with other professionals for holistic care and involves teamwork to support overall communication and well-being. The next is oral stimulation technique, like sensory awareness method, like different textures stimulate different sensation, experiment with soft and rough textures. Like for example, sometimes the patient have difficulty with the solid foods. We'll start with the semi-solid. Semi-solid consistency is always safe for the swallowing. So when the patient with the difficulty with swallowing, so first we try to give semi-solid consistency. If we are giving the semi-solids, what will happen? It will go slowly. So if something happen, they can choke it and take it out. So when we are doing this swallowing therapy, so initially we'll give the semi-solid consistency, then we'll give the soft solid. Then if the patient have a chewing skill, then we will give the soft solid. Then we are giving it. At the end, we'll give the liquids, because liquids, when we are giving the liquids, it will go so fastly. So it will get aspiration or penetration. And also temperature will helps. Like if the patient have any difficulty with the gag, so we'll give the thermal stimulation also. So, for example, the thermostimulation involves using temperature-based methods for oral motor rehabilitation. I already mentioned here, like patient doesn't have a gag reflexes. So what we will do, we'll give different thermal stimulation, like hot, cold therapy. So we can use ice, or also we can use hot water to give the thermal stimulation.
So these were all things that we could do for individuals having autism spectrum disorder or cerebral palsy. So our last topic of discussion is going to be alternative and augmentative communication, which is mostly given for or suggested for individuals who are having very limited speech abilities, or wherein we feel stuck, or we have no idea as to what can be done in terms of speech, or they are not at all attempting to speak as such, and we want them to communicate in some way or the other. We can suggest them to go forward with alternative and augmentative communication, which is better known as AAC. So this AAC would include sign language, picture boards, and electronic devices. So AAC can be better classified into 3 different types. That's going to be low technology, medium tech systems, as well as high technology. Low technology would be it would be less expensive and easily available. You could also do it at home by yourself, which mainly includes the communication boards, books. It could be tangible symbols or symbol communication charts. The next one would be the medium tech system, where the device, it would be just like the low tech device, but with some technological elements like a battery or a switch, but it would be easier for them to function when compared to the high technology. And high technology would be the tabs that we use, or it could be on the mobile phone. So it's going to be a computer-based electronic communication system. So we have just put in a few pictures of AAC devices. This is a picture book where they can just point. So as we've told earlier, AAC is used for individuals with very limited speech abilities. So they can just use, all they have to have, a few prerequisites that we would recommend or suggest is they should be having good or appropriate comprehension. as well as pointing. So we would want them to understand what each picture resembles, or what each picture is, as well as to point appropriately to it to indicate their needs. So this is a picture book wherein they can just point out to whatever they would want to communicate. The next one is going to be PECS, which is Picture Exchange Communication System, better known as PECS, wherein, as you can see, they are going to have different Velcro strips with the pictures. So each Velcro strip could be different categories that you can categorize the pictures into. And what they will have to do is they will have to pick up one picture from the blue part, and then they would have to put it down on the yellow portion. So the ones who can actually form a sentence, then they can actually communicate with using the Velcro strip and the picture, they could form an entire sentence to communicate their needs. And this one is an image of the device, the high technology one, wherein we would download the software and then they would communicate their needs. So this software will be inclusive of different categories. So they've got like greetings, actions, it could be eat, play, the stationery, so different categories. So they will have to choose the right category, and then again, all they have to do is point to it and the device is going to have a voice output. I hope it's clear enough about what can be done for what exactly is done over here in speech and language therapy, what are the disorders that we deal with, and the common disorders that we deal over here, the management approaches, as well as if you are facing with any challenges or queries or anything regarding children who do not speak at all, how you can go forward with it and how you can use AAC into their life. So I hope this discussion was an informative one. And is there any questions that you would like to ask us? We would love to answer to your questions. Okay. Rosemary wants to ask something.
My name is Rosemary.
Yeah.
Hello. My name is Rosemary, autism teacher from Kenya.
All right. We can hear you. Go forward.
Kindly explain to me what is finger analogy.
Can you repeat again?
Finger analogy or hand analogy.
Hand analogy that we use in stuttering.
Hand analogy. I don't really get the meaning of that
So analogies
word.
are basically, yeah.
Yeah.
Yeah, analogies are basically the ones that we use in stuttering management for children as such. So we do not suggest or recommend this to adults because they can directly implement the techniques that we had discussed. Analogy is wherein we can either provide them with a picture or a pictorial representation. For example, we've got various analogies like it could be lily pad analogy, the finger and thumb analogy. So there are various analogies wherein we would explain using a picture to the children so that they are going to have an idea as to what stuttering is and how they can overcome or tackle stuttering. So you've asked me in specific about the finger and thumb analogy, wherein we would ask the children. So we are going to use our hands, the palm and the fingers, and then we're going to ask them to speak on something. So if they are asked to describe about themselves, we would ask them to go in a very slow and rhythmic manner, wherein they're going to use their thumb and finger. And in case they feel like they're going to exhibit or they're going to show some characteristics of stuttering as such. So, for example, if it's going to be repetition, they're going to tap on the same finger for 2 times. So, if it's going to be a prolongation, as we have told, they might hold the thumb and the finger for a longer duration and then they might leave it. So if it's going to be a normal flow of speech, they will be having it in a very rhythmic and continual manner. And if they encounter any of the characteristics of stuttering, they're going to show it using the thing. So if it's going to be repetition, they're going to tap again. If it's going to be prolongation, they might just hold up for a long time. So in that way, they're going to indicate the stuttering as such. Is it clear?
It's clear, thank you.
Any other questions? Anybody else? Any doubts or queries that you want to ask us? If you want, you can just type down on the chat box if there is anything. So can we wind up if there are no questions or queries? Or shall we can just put up our email ID over here in case you feel like you've got some doubts even after ending the meeting over here. If you are free to call us, or you can just put down email. We'll just type down our email ID over here so that you can connect with us if you have any queries regarding speech as such. So we have put in the email ID in the chat box. You can just note it down or have a note of the email ID just in case you want to contact us or you want to ask about something relating with speech and language or swallowing as well. You're free to ask anything, whichever you want to. So can we wind up or? So we've got a question here in the chat box wherein Rosemary has put up like, I am an autism teacher. Can I train as a speech therapist? Definitely you can. We've got courses that offer speech and language therapy. So you can just go forward, enroll up for the course, and then you can be a speech therapist. They've even got diploma courses if you would love to check up on that. Diploma courses that would have in specific for different disorders as such. Like not just for speech and language in general. So that's going to be a speech and language pathologist. But they've got courses that would that you can do for maybe speech disorders, language disorders. So different category wise you can enroll or you can just check up on the internet for the diploma courses. Any other questions? So we are going to wind up the session here. We hope it was an informative one and you could, even though the entire presentation or the discussion was not understandable, at least you could get a few things here and there. It has enhanced your knowledge as to what you knew about speech therapy. Hope we could add in a few information or we could provide few insights about what we do here and how things are in speech and language therapy. It was nice having a small crowd with people listening to us sharing our knowledge, and we had a good time. Thank you so much. Do join in for more webinars to know more about what we do in here. Thank you.